This is your NPR station, KUHF, Houston. News 88.7, a service of the University of Houston.
Support for NPR comes from NPR stations.
Welcome to Hello Houston. Coming up this hour, Texas State Representative James Talarico voted in 5 elections using his parents' address. That's according to a new investigation from ProPublica and the Texas Tribune. We're going to discuss this and more of the day's top headlines. I'm Michael Adkison.
And I'm guest host Doug Miller. If you think the high cost of health care doesn't affect people with insurance, think again. A new report sheds new light on the crisis in American health care.
Plus, it's Thursday, which means it's time for us all to share our latest current obsessions. We want to hear yours, so start emailing them to us at talk@hellohouston.org.
And as always, we want to hear from you. Give us a call or a text at 713-440-8870 or email us at talk@hellohouston.org.
Hello Houston is made possible in part by founding sponsors John Bradshaw and Kathy Sanders, and by gifts from listeners like you.
Live from NPR News, I'm Lakshmi Singh. The Turkish government says that an agreement to reopen the Strait of Hormuz may be struck by Iran and the U.S. as soon as today. Turkey has been assisting in the mediation of the talks. The country's foreign minister stated that a deal was necessary to keep oil prices down. Here's NPR's Hadil Al-Shalchi.
Turkish Foreign Minister Hakan Fidan said that, quote, God willing, the negotiations between the United States and Iran to open the Strait of Hormuz will conclude today with what he called good news. Fidan said that the mechanisms by which the critical waterway would open and for how long are issues still being worked on. He said that a 60-day period to allow oil shipments through was being discussed, and that would lead to a permanent agreement between the two countries. Iran said yesterday that it was nearing a deal with Oman to open the Strait of Hormuz, saying it was in talks for at least 3 weeks. On Tuesday, President Trump said that a deal could be reached this week. Hadil Al-Shalchi, NPR News, Istanbul.
A new Reuters Ipsos poll shows that for the first time in nearly a decade, more people in the U.S. prefer Democrats to Republicans in handling the economy. In a midterm election year, that does not bode well for President Trump, whose agenda depends on Republican allies remaining in control of Congress. NPR's Deepa Shivram reports last night President Trump tried to pitch his economic policies at a Las Vegas, Nevada event.
While Trump is on stage saying his economy is a success and at times mocking the idea of affordability, Republicans like Marty O'Donnell, who's running for Congress in this area, are taking a little bit of a different approach. He's trying to argue that life should be more affordable, that one job should be enough to get by. It's actually kind of a similar argument to what Democratic candidates are saying here, too.
A Senate committee has voted to hold Dr. Anthony Fauci in contempt of Congress. It's referring him to the Justice Department for possible prosecution for refusing to answer lawmakers' questions last week at a hearing about the origins of COVID. Fauci had invoked his Fifth Amendment right against self-incrimination. The Food and Drug Administration has approved the first flu vaccine to use the same mRNA technology as COVID-19 vaccines. Here's NPR's Rob Stein.
The vaccine is called Mflusiva. It was developed by Moderna, the same company that produced one of the 2 mRNA COVID shots. Research indicates Mflusiva may be more protective than traditional flu shots. It can also be updated to adapt to new strains and produced much more quickly. The fate of the mRNA flu shot had been in doubt because of the Trump administration's hostility towards mRNA vaccines in the wake of the pandemic. In fact, the FDA initially refused to even consider the vaccine. Moderna says the new shot can now be available for the upcoming flu season. Rob Stein, NPR News.
U.S. stocks are trading lower with the Dow down 371 points. You're listening to NPR News.
Live from News 88.7 in Houston, I'm Tom Perumian. A massive fire that destroyed a seafood warehouse near Galveston's Yacht Basin is now contained. This according to Galveston officials' latest update this morning. The blaze drew a significant response yesterday from multiple agencies. 2 buildings next to each other caught on fire. Local Galveston officials had to call in for additional resources after raising the incident to a 2-alarm blaze. Keith Spell lives nearby. He says the fire also destroyed some fishing boats.
Luckily, most of the boats are the shrimp boats because shrimp season's all over. They're 80 miles out.
Galveston officials say crews safely rescued 3 people and 1 dog from a building. Residents may continue to see smoke in the area throughout the day as the buildings continue to smolder. Fire crews will remain on scene to monitor the conditions and ensure the fire stays contained. Attorney General Ken Paxton has finalized a deal with Texas Children's Hospital that will create the nation's first detransition clinic. The hospital has 3 months to create a facility designed to reverse gender transition care for free. According to Paxton, Texas Children's was under investigation for roughly 3 years by both the state and the U.S. Department of Justice over allegations it illegally provided transgender care to children. The clinic is set to open at the end of October. In sports, the Astros take on the Padres tomorrow night in San Diego. That first pitch coming your way at 8:40. And checking your weather, we've got a 30% chance of afternoon showers and thunderstorms. Otherwise, sunny with a high near 96, heat index of 105. Tonight, mostly clear with a low around 79. On Friday, another 30% chance of showers and thunderstorms in the afternoon, sunny with a high near 95 and a heat index of 103. Right now, it's mostly cloudy, 90 degrees on the UH campus. Get more news and information. Go to HoustonPublicMedia.org. I'm Tom Perumian, News 88.7.
Support for NPR comes from NPR stations. Other contributors include Made in Cookware. Made in Cookware is crafted by chefs for chefs and designed for restaurants and home kitchens around the world. Their cookware can be found at madeincookware.com. This is NPR.
From Houston Public Media and News 88.7, it's Hello Houston, an open forum on today's biggest stories affecting Houston and beyond. Call now, 713-440-8870, or let us know your thoughts on today's topics by emailing us at talk@hellohouston.org. And now, Hello Houston.
Hello, Houston. Welcome to this Thursday. I had to think about what day it was because we weren't on the air on Monday. This Thursday edition of Hello Houston. Ernie Manouse still out of the office. He is on vacation, but we are excited to have him. And we did announce earlier this week we have a new co-host officially joining the team here at Hello Houston. So we're excited to have them back and have them get rolling on this new version of Hello Houston. I will say that if you've missed Ernie Manouse, you're going to have him on the show later on. He had a conversation with Morgan Freeman. Yes, that Morgan Freeman last week. And we're going to air that discussion as Morgan Freeman is coming to town to Houston. And another icon, perhaps of the same caliber of Morgan Freeman, is joining me here at the co-host desk, Doug Miller.
I wish I had Morgan Freeman's voice. Oh, boy.
Do you have a favorite Morgan Freeman role?
A favorite Morgan Freeman role?
I know, I'm putting you on the spot.
You know what? I loved him in his first movie. It was called Street Smart.
Okay.
He was in a movie with Christopher Reeve. Really interesting movie about a reporter who makes up a story. And he was terrifying in that movie.
Wow.
Christopher Reeve later said nobody knew who he was. They said, yeah, weren't you scared playing that next to that guy? He looks scary. You know, no, he's a Shakespearean trained actor. You know, so yeah, good movie. Check it out.
And now I'm just here. You know, when I think of Morgan Freeman, all I can think of is you know, a Driving Miss Daisy type. You know, I'm very laid back. I'm easygoing character, so it's hard for me to picture like a frightening Morgan Freeman.
He's got incredible range.
I love it. I love it. Well, if you want to hear from him and what he's doing here in Houston, stick around to Hello Houston. I do also want to make a point of saying that we are doing our current obsessions a little bit earlier than anticipated. We normally do that at the end of the second hour. We have a special guest coming at the end of the second hour, so we decided to bump up current obsessions to the end of the first hour. So make sure to send in those current obsessions just a little bit earlier than you usually do. We want to hear them. We want to talk about them, so make sure you get them in. We're going to talk about those before the hour is up. But Doug Miller is here joining me, and he is here to give us the latest headlines. So, Doug, take it away.
Well, there's a new wrinkle in the neck-and-neck race for U.S. Senate here in Texas. Now comes a report that Democratic Senate candidate James Talarico voted in 5 elections using his parents' address after he'd bought another home for himself. that may have violated Texas voting laws, according to ProPublica and the Texas Tribune, the two nonprofit journalism outlets that broke the story. Just a couple of weeks ago, Talarico accused his opponent, Attorney General Ken Paxton, of voter fraud for similar behavior. Paxton reportedly voted using an address where his estranged wife, State Senator Angela Paxton, hasn't lived for 2 years. Talarico's campaign declined to answer questions about his residency and his voting history. A campaign spokesperson said, as he put it, right-wing actors had made credible threats about trying to find Talarico and his family. Needless to say, Texas law requires that residents register to vote where they live. So what do you think? Do you think Talarico may have violated state voting laws? Did Paxton vote where he shouldn't have? And does this really matter? That's an interesting question. Will it affect any votes? Call or text us at 713-440-8870. I must say, in all the decades I covered Texas politics, I don't recall anyone ever getting busted or prosecuted for voting in the wrong precinct, blah, blah. Anyone in elected office, I should say. There are all kinds of questions about, Senator so-and-so doesn't live in his district, council member so-and-so doesn't live. There was one mayoral candidate who didn't live in the city of Houston, but I never heard of a prosecution. I never heard of anyone being bumped off the ballot or thrown out of public office for not meeting residency requirements.
Yeah, I think, I don't want to speak on behalf of the Texas Tribune. They were the ones with ProPublica that reported this story. I have to think the story began because you have a candidate in Ken Paxton who is so staunch on follow the voting laws to the T.
Voter fraud.
Voter fraud, prosecuting voter fraud. And you had a case where it just so happens that Ken Paxton is also going through a very public divorce right now with Angela Paxton, and she says he has not lived here for 2 years, but that's where his voter registration still is. And so you wonder if this story would be there had he not been going through that divorce, essentially. And I will make a note of saying that in their new reporting about James Talarico, the writers with the Texas Tribune and ProPublica state that it was actually harder to get a hold of Talarico's addresses where he's voted because he's not going through this very public divorce, essentially, that they had to ask the campaign for his voter registration in previous years. And that's what essentially yielded that he had been using his parents' address for a few elections, not the most recent one as I understand it, but a few elections prior to that when he was living at his home.
That is curious they couldn't get voter registration information. I thought that was all public record. But,
so I can answer that. Part of it is because there is a law on the books in Texas that shields elected officials from having their personal addresses listed. And so Talarico and his campaign have said that Talarico has faced what they called credible threats since he's launched his Senate campaign. So they have shielded his personal address from the public record. And so the reporters then asked the campaign, will you give us unredacted voter registrations? And those are what essentially yielded that his parents' house is where he was registered to vote for a couple of elections.
So with Paxton, there's a bit of an hypocrisy argument that can be made as a result of that. With Talarico, I'm surprised that Talarico's campaign didn't conduct opposition research on itself. I mean, this is kind of a standard procedure for any political candidate. You do opposition research on your opponent, but at the same time, you do opposition research on yourself because you want to find out if there are any hand grenades lying around in your past, and you want to be ready for them when they come up. I know a political consultant who actually did the same thing with herself. She ran something. She found something. She wouldn't tell me what it was, but she's ready for it if somebody ever brings it up.
Right.
I'm really surprised that the Talarico campaign didn't know about this, and maybe they did. Who knows? They may have already found out of it. May have had it sitting around and ready with their response at any point. I'm surprised the Paxton campaign didn't have something prepared.
Right.
It's just odd to me that the Talarico campaign must have known that once they dropped this little bomb on Paxton, saying you didn't vote, you voted at your ex-wife's house, whatever, they had to know that was going to backlash back on the Talarico campaign, I would think.
Yeah. It makes me think, and I love the way that you asked this question, and I'm going to put it back out to the listeners to give us a call, 713-440-8870. Does this matter? Would this affect your vote? Because at the end of the day, I can't think of anyone in my, I have my own circle, but I can't think of anyone who said, I was going to vote for Ken Paxton, and then I found out he doesn't live where he says he lives. Or same for Talarico. I was going to vote for Talarico, but I found out he voted in previous elections where he doesn't live. I think it's one of those things that's really interesting to know that there is, a potential violation of election law. I hate to say that's just an interesting little tidbit, but you know what I mean.
But our politics are so tribal now that people forgive of candidates wearing their own jersey of just about any infraction. Think back to Bill Clinton back in the 90s when Democrats were defending him no matter what, when there were credible witnesses coming forward that he had committed a sexual assault, but nonetheless he was defended. Then we've got Trump. Where do you start with Trump? The man who brags he could kill somebody shoot somebody on Fifth Avenue, and his poll numbers would still go up. There are people who will support Trump no matter what he does.
Sure.
So I don't know. I just can't see this having any impact.
Having any sway.
But it kind of it throws some dust in the machinery.
Sure.
If you're trying to run a campaign.
I also think it's one of those things where we're now at a point when I don't know how many undecided voters you're going to sway one way or the other. Sure, that there's still 3 months left until the election. There's plenty of time for something to happen there. But I think we're at a point when people know who the candidates are. They know what they're voting for, essentially. So we'll see what happens.
I think all of this could affect. I mean, the entire way. I don't think everybody's made up their mind just yet. I think that I think there are especially a lot of Republicans out there. I know some establishment Republicans who are very upset about what happened with John Cornyn.
Sure,
and they have told me privately, I can't vote for Ken Paxton.
Yeah,
they're not saying I'm going to vote for James Talarico, but they are telling me flat out, I just can't vote for Paxton.
If you're an avid Texas politics watcher like myself, it was pretty notable this week. Ken Paxton has been on the campaign trail and did a couple of rallies that in the Dallas area, the person who introduced him was State Representative Jeff Leach. Leach and Paxton go way back. They're old friends, but Leach was one of the leading voices for the impeachment of Paxton and had very emotional words when that happened, saying, he was my friend, and I think that my friend did something wrong, and was, holding back tears. And that sort of severed their relationship. But now here we are 3 years later, and they seem to have made amends, and Leach is now endorsing Paxton on the campaign trail with Paxton. Same with Briscoe Cain in Houston, as I understand it. That Cain introduced him, and Cain was also one of the leading impeachment managers from the Republicans, and he introduced Paxton last night.
Yeah, sounds like Lindsey Graham and Donald Trump. Strange bedfellows.
Sure. 713-440-8870 is the number to call to let us know what you think. We're getting some comments from our YouTubers. Wine Goddess STX on YouTube writes, I would like them, I assume that's us, to clarify the timeline for Talarico's voting/residency. I'll add that he purchased a home in June of 2022, but he did not change his voter registration until September 2024, according to the Texas Tribune and ProPublica. So he has since changed his voter registration, as we understand it, but for those elections between June 2022 and September 2024, he did not change his registration, according to that reporting. Doris Murdoch 9801 on YouTube writes, Paxton was in a different country while Talarico was in county rather. Paxton was in a different county while Talarico was in the same district. Still, both should have updated their registrations. More importantly, Paxton does have a score of indictments/moral failures. This YouTuber sharing their thoughts on Paxton as a candidate given the impeachment and the other allegations that have been brought against him. Of course, he was acquitted of those and I believe does not have any criminal charge against him right now.
And it should be noted, according to the report that I read in the Texas Tribune, that Talarico he voted in the same House district that he lived in. He voted in the same. There might have been some local offices affected. He lived. It was the same state Senate district, and so on. Some local offices, local elections could have been affected. But
that's a good point. A good point that it, whether the registration was different or accurate or not may not have actually swayed the results of the election. A good point. 713-440-8870 is the number to call. Another story that's been on our minds, and we've been referencing it throughout the week and have not actually talked about it officially in our headlines, but new data centers are not going to be able to connect to the Texas power grid until state regulators complete a comprehensive audit of these facilities. That's following a directive from Governor Greg Abbott that came down on Monday. In a letter to the Public Utility Commission of Texas and ERCOT, Abbott called on those agencies to collect information on water and power usage at these facilities and to pause data centers' ability to connect to the grid until the audit is complete. ERCOT says large energy consumers are requesting 474 gigawatts of power. That's more than 5 times the amount of energy used to power the entire state during record-breaking demand. About 90% of those new requests are from data centers. What are your thoughts on Abbott's stance? We know that Democrats are pushing back against Abbott. We heard from State Representative Lina Hidalgo, his gubernatorial challenger in the race this November, and she says that this isn't enough, that there needs to be a special session on data centers. What do you think? What do you think about data centers entirely? Give us a call, 713-440-8870. I believe it was, we've gone back and forth with guest hosts, but I believe it was you and I that were talking about data centers becoming sort of the trendy issue, if you will, for this November election and local elections particularly.
And it's so interesting to me that this, I have very conservative friends who are just flat out saying, this is something we will not compromise on. This is affecting a lot of rural voters. Of course, Republicans do, that's the base for Republican voters in the state of Texas, rural areas. But they're upset about this one, and it's not something that they want to compromise on. I think this is the kind of thing that could flip some votes. It's lucky for Greg Abbott this is not an election year. I think this could hurt him.
Yeah, it is an election year for him. He's up against Lina Hidalgo.
Oh, I beg your pardon. Yeah, of course. Of course.
No, of course. In the other election, too, I know that data centers has been a point. Talarico has spoken at length about data centers. I don't believe Paxton has on data centers. So to your point, it is something that a lot of politicians are going to start weighing in on. 713-440-8870 is the number to call. Adrian is on the line from Sugar Land. Adrian, welcome to Hello Houston.
Hello.
Hey, how you doing?
What's on your mind, Adrian?
Good. My name is Prince Adrian with Mike. I'm calling about Ken Paxton's recent nomination and how his nomination and Trump's support reflect current trends in politics. Trump has shown that regardless of what a politician does, that if he stands his ground, that he can still be able to carry on his manifestos or do whatever he is able to do to be able to win an election. So Ken Paxton, in his own way, reflects Trump's ideals and persona. So little wonders that Trump would support him, and in many ways, politics no longer conform to political correctness as it was known to be in times past. Today's politics is all about doing what you want to do as long as you can appeal to the electorate. So Ken Paxton may very well represent the politics, represent the politics of our own time, of our own unique times in political spectrum. That's
Adrian,
what I have to say.
Adrian, let me ask you something. We posed this question a bit earlier. Do you think this business of candidates voting in places where they're not supposed to vote, or registering to vote in homes they've moved away from, will that have any effect on who you vote for?
No, it wouldn't.
Yeah. Does that bother you at all?
No, it shouldn't bother me. It doesn't bother me because it is what the candidate represents or what he stands for or what he would do to benefit the electorate that would matter the most to me, not the geography of his residence or where he stays or doesn't stay. It is what he represents that matters the most to me.
Very good.
Adrian, thank you so much for calling into Hello Houston. We appreciate your time. Lots of good discussion, lots of stuff to look forward to in the November election. Stay with us because I'm sure we're going to talk about it some more. But coming up on Hello Houston, we're going to speak to Dr. Katherine Hempstead. She is the Senior Policy Advisor with the Robert Wood Johnson Foundation. We're going to talk about healthcare affordability. I'm sure everyone's going to want to listen to that. Stay with us as Hello Houston continues.
Meet Tio Choco. We just took his keys for the day and gave him a Ride Metro fare card. This is his story. Visit ridemetro.org/Choco to find out where is Choco.
So the podcast, were you raised by wolves? It's coming up on The Splendid Table.
You can listen to The Splendid Table. It's on this Sunday at noon.
Houston Matters wants to hear from you about story or guest ideas for future programs or pet care or gardening questions you'd like us to tackle when those subjects come up each month on the show. Or maybe you have suggestions for how we can improve the program and provide a better public service. Reach out anytime at talk@houstonmatters.org. I'm Craig Cohen. Join us for the next Houston Matters, weekday mornings at 9 here on News 88.7.
We yearn to get back to a time when we worked with our hands, but what era are we actually talking about?
Is there something really positive and radical here, or is going nostalgia just something that's possibly reactionary?
The centuries-old longing to get back to the good old days of craftsmanship and how that can go awry. That's next time on Think.
You can listen to Think. It's on tonight at 11 o'clock.
Universities are struggling to keep up with technology, both teaching it and using it. And yes, we are talking about AI.
One of the things university is really good at is posing questions not about what's happening today, but about what might happen a decade from now.
Here's a question: how much is it going to cost? I'm Kai Rizdal. That story next time on Marketplace.
Listen to Marketplace. It's on tonight at 6:30.
And now back to Hello Houston. To comment on any of today's topics, call or text 713-440-8870 or email us at talk@hellohouston.org. And now, Michael Adkison and Doug Miller.
New research from the Robert Wood Johnson Foundation finds that nearly half of all working-age adults in the United States struggled to afford health care last year, and more than a third said someone in their family went without needed health care because of the cost. As healthcare expenses continue to rise, many families are facing difficult choices between paying for medical care and covering other necessities. So joining us now to talk about it is Dr. Katherine Hempstead. She's a senior policy advisor with the Robert Wood Johnson Foundation, and she's going to discuss the findings of that study and what they say about the growing challenge of healthcare affordability around the nation. Dr. Hempstead, welcome to Hello Houston.
Hi, thanks for having me.
It's good to have you here. So, Dr. Hempstead, your report has a staggering headline. 46% of working-age adults, in other words, people between 18 and 64, struggled to afford health care for their families last year. Now, a lot of people assume if you have health insurance in this country, you're okay, that struggling to pay for health care is just an issue for people who are uninsured. What does this tell us about the financial security of people who do have health insurance?
Well, thanks. Yeah, it tells us that's increasingly not the case. And when we survey Americans, healthcare is the leading economic issue that people talk about as being problematic for them. It's a more important problem than rent, than groceries, than gasoline, than utilities. Even people with insurance are finding it harder and harder to pay their premiums, and then they have very high out-of-pocket costs, which make it hard for them to actually access the care that they think they have the right to access, given that they're paying so much for insurance. So it's really a problem that's affecting everybody.
And it's, as you mentioned, out-of-pocket costs. Deductibles are so high on so many policies. Just it's really incredible. Your study found that about a third of all working-age adults, 35%, reported that someone in their family is not getting needed medical care because, well, they can't afford it. From a public health perspective, what are the long-term consequences of this when more than a third of families start skipping their doctor visits and delaying procedures or even rationing their prescription medications? What's the impact of that?
Well, I mean, it can range from really affecting people's quality of life and their productivity to really being tragic. If people are, for example, not following up on a symptom that's concerning them because they're worried about what kinds of costs they might be asked to bear, or if somebody recommends that somebody get, for example, something like an MRI or some kind of imaging, but they are early in their deductible, so it's going to cost them several $100s. Many people are choosing not to do that with really terrible consequences because they might be, missing the opportunity to diagnose a serious illness at an earlier stage. But there's also just sort of less dramatic but very significant day-to-day impacts on people's quality of life. For example, people are not going to take a medication that really helps them with their migraines so that they can be more productive, or deal with their eczema, or, follow up and get some physical therapy that would really help them feel better and be able to be more productive and just be more effective in their lives. So there's a range of really, terrible consequences when people are not getting care that would really benefit them.
One question that I had is, looking through the report, there were numbers that said that, the people who said that they don't have health issues were people who also didn't report having issues paying, or people who said they were in good health did not have as much issue paying for their health care coverage. How do you think that corresponds with people who may not know that they are in bad health? They may say, oh, yeah, I'm in good health, but it's because I haven't gone to the doctor and haven't been able to pay for a doctor's visit because I've been paying for my rent, essentially.
Well, I mean, it is the case that people that have more health issues tend to have a harder time paying for it because they sort of need more. So they have higher costs. Maybe they're on 5 or 6 medications, et cetera. But there are also people who are in some kind of denial, and they say they're fine and they don't need to go to the doctor. But the real reason may be the, worrying about the cost of paying for it, and then kind of worrying about like what's next. If I'm told I need to get lab work or I need to get something else, then what is that going to cost me? And I'm worried about paying for that. So I'm just gonna, kind of say everything's fine and not follow up at all. And, we see this, we have some kind of natural experiments sort of to look at the upside and downside of what happens when the costs of care gets more expensive or cheaper for people. So, we saw when we expanded, for example, Medicaid coverage under the ACA, which I know didn't happen in Texas, but we were able to do a lot of good studies in other states to see like, okay, what happens to things like cancer and other kinds of serious illnesses when people are actually able to get access to care. And we did find, declining rates of serious illness and mortality when care became more affordable for people, and they were actually able to follow up on those symptoms. And now, unfortunately, we're kind of going to run it in reverse because a lot of people are losing their coverage. So I think, unfortunately, we're going to start to see people not following up on those things, and consequently see increased rates of serious illness and death.
713-440-8870 is the number if you'd like to call and join the conversation, have any questions about this research. You touched on an interesting point there. The data was broken down in some cases by region, and Americans living in certain areas of the country are more likely to have problems paying for health care. Tell us where you saw that phenomenon and why.
Sure. Yeah, I think we always find that people in southern states and people in rural areas are facing higher economic burdens when it comes to healthcare. We see more uninsurance in those areas for sure, and we also see people with lower incomes and less generous employer plans when they have coverage. They may be getting coverage from an employer that is shifting a higher cost-sharing burden on to them. And there's also kind of a racial and ethnic pattern that we see as well, where we see Black and Latino populations more likely to be in, those kinds of situations where they either don't have coverage. A great majority of the people that are in the so-called sort of coverage gap that comes from the states that didn't expand Medicaid are, Black and Latino. And then we also see less likely to have access to, really good quality employer plans that pay a little bit more of the cost sharing. But we're also finding just across the board, people are hurting and are really citing the cost of healthcare as a major worry for them.
We're getting comments on our YouTube. One writer writes, keeping my health care this year has dang near crippled my budget. I often feel like I'm drowning. With that, I'm curious, Dr. Hempstead, in your survey, did you ever ask what people paid? What were people paying first before their health care? Was it rent? Was it groceries? Did that ever come up in your research?
There have been many, many studies that have shown the kinds of trade-offs that people have to make between paying for healthcare and paying for other things. And certainly people that are getting their coverage in the individual market have seen really, really significant increases in costs this year because the enhanced premium tax credits expired. So the person that talked about paying for their healthcare dang near killed them may have been somebody that saw just an enormous increase in premiums and just felt like they, weren't able to not be covered because, not being covered exposes you to so much financial risk. And if you already know that you have a chronic condition and you really need to have ongoing access to care to be able to function, I mean, people are going to make incredible sacrifices to keep that coverage. And we do see people making those kinds of really terrible trade-offs all the time.
So about 1 in 5 people, according to your report, with private insurance reported a massive spike in out-of-pocket costs. Meanwhile, people on the marketplace plan saw their premiums surge more than 20% going into this year. Why are insurance premiums and deductibles rising so rapidly right now? And why are people on, I suppose it's commonly known as Obamacare, taking such a big hit?
Well, there's a general issue and there's a special issue. I think the big meta general issue is that in this country, we pay more for healthcare services and more for medications than people in other countries just because of the kind of system that we have. So that's kind of table stakes. We're just kind of going into it with that. And then this has been the last couple of years, and I think next year too, have been bad years from a sort of medical trend perspective. So people have been using more care and there have been increases in costs. We have sort of general inflation, so people are paying more, so insurers are paying hospitals more, and then premiums are going up, and some of that's getting pushed to people. So it's sort of an expensive system having some bad years, last year and this year. So the Milliman Medical Index, which sort of keeps track of the cost of an average employer plan, showed a 7.9% average increase, which was the highest in a decade. And the next one is going to be, I think, even higher, people say. So there's that. But then in the Affordable Care Act, there's kind of a special policy issue because there was for several years an expanded premium tax credit that kept those plans more affordable, and that expired. So we're seeing kind of a hockey stick curve of cost in that market, which has made people really have tough decisions. And a lot of people have dropped coverage. We estimate that approximately 5 million people are going to become uninsured because of that policy change. But then in general, even people that are still in their employer plan are finding, wow, my coverage costs me so much that I don't feel like I actually have access to care.
Kind of going off of that, I know that Texas has one of the highest rates of uninsured people across the country. Yeah. I think of people in my life, and I certainly am not presenting myself as some voice of a generation, but I'm a younger guy, and I see the people in my life, and I feel like there's a lack of healthcare literacy, of understanding the ins and the outs of what makes good healthcare and what doctor I should go to and how I should approach those situations. Walking into an urgent care when this could have just been a routine doctor's appointment. You could have gone to a minute clinic. Do you see that in people reporting these higher costs of healthcare?
I think that there is so much coming at people lately that it's very difficult to be a consumer. I think there are a lot of sort of quasi-wellness products that people are spending a lot of money on now instead of things that are more evidence-based and more sort of, comprehensive coverage and things that will really keep people healthy. I think the proliferation of things like standalone emergency departments, which you have had quite a bit of in Texas, and urgent care centers are things that I don't think the world has figured out whether or not those are things that reduce costs or increase costs. Because on the one hand, you can substitute that for an emergency center. On the other hand, you can substitute it for nothing. So we're not really sure what is the, kind of the right combination of access to care that both gives people the care they need and keeps costs as low as they can be. And I don't think we've figured that out yet. And we have sort of a combination of people trying to make money and people trying to constrain spending. So I think you're raising a great question. Increasingly, people are going to the internet and using AI to figure things out, sometimes with good results, sometimes not. Hospitals are using AI to find ways to bill insurance companies more. Insurance companies are using AI to try to find ways to pay hospitals less. So, and to, deny care to enrollees. So we see, a lot of different ways people are trying to get information about what to do. But I do think that a lot of consumers are not sure what is the best thing for them to do. And then there's a lot of just flat out scams. People are trying to market plans, health things that look like comprehensive coverage to people for them to buy that, they can use words that make it sound like it's an ACA marketplace plan or something like that. And then a lot of people are really disappointed when they actually are not getting the coverage that they thought they were going to get, or a lot of things are excluded. So it's so difficult for your state and federal regulators to even keep up with some of the things that are coming at people.
I have to tell you my own experience. When I went on Medicare a few years back, I was lucky enough to have a consultant tell me what to do. I had no idea what I was supposed to do with that. And I get the feeling a lot of people are doing just that, farming it out to someone, paying someone to help them out with these things. Yeah.
Yeah, I mean, Medicare is theoretically the part of our healthcare system that works the best, that people are the happiest with, because it's universal. Everyone's eligible once they turn 65. So that's a great thing about it. But still, there are decisions to make. Medicare Advantage versus traditional Medicare. If you get Medicare, traditional Medicare, you're really going to need a supplemental plan. A lot of people don't know that, or else there's quite a bit of cost sharing. And then you have to choose a standalone Part D plan. And, these are very difficult decisions. And I think that sometimes people get great support from a broker. But if you're not sure you want to use Medicare Advantage, you might not need a broker. And then I think we have a pretty underpowered public system of information for people. So I'm not surprised that you found it to be a confusing process.
Following up on that, your report, your research focused on working age folks, people between the ages of 18 and 65. Was part of the reason that you decided that simply that people on over 65 on Medicare, obviously, I wonder, are they having problems paying their premiums as well? I know your data didn't cover that, but I get the impression some people on Medicare are also having problems paying their premiums.
Yeah, there are some problems. There are some programs for lower income people to get some help with their Medicare premiums. Unfortunately, I don't think that as many people know about them as they should, or it's a little bit complicated to get the word out about that. Then there are also people that are, if their income's low enough, they're dually eligible for both Medicaid and Medicare, and then Medicaid will pay some of their costs. But I do think that people that are eligible for Medicare are in for a bad surprise this fall, because the federal government recently announced they've removed a little bit of a premium subsidy from Part D plans. So if you're going out to shop for a standalone Part D plan, which a lot of people that have traditional Medicare will do, if you're in Medicare Advantage, it's kind of rolled in. But if you're looking for a regular Part D drug coverage plan in Medicare, you're going to find that it's more expensive this year, and you may find that you have less choice. So I think we tend to focus on the working age population because they're sort of subject to a different set of, problems than Medicare. And in some ways, I think a lot of people would say, hey, that's the part of our health system that works the best. But even there, a lot of people that age have a lot of healthcare needs, and they spend a lot of their income on healthcare, and that's why we, in recent years have sought to negotiate prices that Medicare pays for, and try to do some things to leverage buying power so that we can make that care cheaper for the people that use it.
713-440-8870 is the phone number to call or text if you want to join this conversation about healthcare costs. We talked earlier about geography and the way that geography played a role in the research and looking at that. One thing that I thought was particularly interesting was that you guys measured how these trends compare between rural and urban areas. And it's really only just 5 percentage points difference that rural adults, 50% of them say that they have trouble paying their healthcare costs, as opposed to 45% in urban areas. Texas has both, but at the same time, in the South, it's almost 10 points higher that adults have a harder time paying their healthcare costs than adults in the West or the Northeast. Why do you think that is? Do you have a sense of the causes that contribute to that?
To rural problems in general, I mean, I think that in rural areas you have kind of the combination of people that have less money, have less generous benefits, have poorer health, and then you have a financial system, a healthcare system that's more fragile with, and less competitive because there's fewer people, so there are fewer systems, there's less competition, the systems that are there charge more money. So healthcare can be more expensive in rural areas, and the rural hospital system is under a lot of stress because it's especially dependent on Medicaid in many cases and public payment because there are fewer people there with employer insurance and with sort of generous employer insurance. So it's a place where people are struggling more and the healthcare systems that serve them are struggling more. And you probably heard stories or even covered stories about hospitals closing or hospitals eliminating things like labor and delivery or sometimes chemotherapy because they are not able to finance those more expensive specialties, which obviously places people at a really serious disadvantage.
So your data shows a massive disparity for people who are already vulnerable. We've been talking about people, your average working stiff, basically, but affordability struggles jump to nearly 69% for adults with disabilities, over 60% for those with chronic conditions like cancer or diabetes. And on top of that, Black and Hispanic adults are experiencing those hardships at much higher rates than white adults. How is our current healthcare system failing the very people who need it the most?
Oh, that's a great question. I mean, I think that there's a lot of historical discrimination, racial discrimination in our country that has resulted in the fact that Blacks in particular and Hispanics are less likely to have well-paying jobs, and because of historic racism and exclusion from economic opportunities that stretch back, many generations, and then are less likely to have jobs that have generous health insurance, less likely to have incomes that would allow them to afford a lot of out-of-pocket spending. So in some ways, the structure of our healthcare system kind of reinforces historic discrimination and puts people at particular risk of not getting access to care who have historically been the victims of discrimination and racism. So it's a system that's not perfectly designed to smooth things over. I mean, we certainly have means-tested programs like Medicaid, but Texas is a good example of a state that decided they didn't want to expand Medicaid under the ACA. So then you have people that are essentially they're too poor to qualify for the ACA, but they're not able to be in Medicaid because they aren't, categorically eligible by being an infant or a pregnant woman or having a significant disability. And so then you really have to ask the question, what are these people supposed to do? I mean, these are people who, by definition, have very low incomes. They may be working, but they're not working. They're working at a gas station or something. They're not working somewhere that's going to give them health insurance. So, these people are in what we call the quote unquote coverage gap. They're disproportionately Black and Latino. What are they actually supposed to do? Our system has no answer for them.
Here is the hardest question of all, our last question for you, Dr. Hempstead. How do we fix this? I mean, if you could grab state and federal lawmakers by the lapels and shake them, what would you tell them they need to do?
I would say, okay, I'm gonna duck a little bit. I'm gonna say there are a lot of ways to make things better. We spend too much for the services that we use. We have an enormous amount of administrative costs because our system's so fragmented. Which is one of the reasons it's very unfair. Some people have things, other people don't. We leave a lot of people out. We've been talking about that. and we have terrible outcomes. So there are a lot of ways to make it better by creating systems where we're able to leverage buying power more, pay less for things, make things more universal. There's lots of different ways to do that. But the reason I think that we're talking to folks right now is because, the first thing we have to do is to make sure our policymakers understand that the time for change is now. And that's why we have this campaign, One Nation Overcharged, which is trying to corral people to use their voice and let people know that we really need to have a healthcare system that works better for everybody. And it's going to take some painful changes and trade-offs, but there are many ways we can improve our system, and we only have to look across the ocean to some of our neighboring countries who have found simpler ways to make this work. Not that it's ever perfect, not that it's ever easy, but there are certainly a lot of good examples for how to change the system. So I would like to make sure that your listeners know about our campaign, One Nation Overcharged. They can go to the website, onenationovercharged.com, see events, ways to contribute, let people know, because what we're really trying to do right now is socialize this issue and the idea that the system is not working well for anybody.
Dr. Katherine Hempstead is the Robert Wood Johnson Foundation researcher. Thank you for joining us today on Hello Houston.
Sure. Thanks so much for having me.
We appreciate it. Coming up, the moment you've all been waiting for, current obsessions. Stay with us as Hello Houston continues.
Meet Gamola, songwriter, world-class violinist, and award-winning multi-genre artist. We just took his keys for the day and gave him a Ride Metro fare card. Visit ridemetro.org/Gamola to learn more about his ride.
Engage all Houstonians wherever and whenever they tune in. Amy Gambino, Amanda and Morris Gelb, Jeannie Giles, Maria and Rex Gray. Thank you.
New federal data shows the vast majority of people with serious addictions still are not getting treatment. Critics say there are low-cost medications proven to treat addiction and save lives, but most doctors don't prescribe them.
We would not allow, as a society, people with heart attacks to come to a hospital and not get appropriate treatment. This is as serious as that.
I'm Elsa Chang. That's on All Things Considered from NPR News.
You can hear that today at 3 o'clock.
Sometimes a first-timer to Italy finds it can get a little crowded.
So you need to adjust to our space. I mean, you don't want Italy to be Switzerland.
And hear what a fast-paced American family found when they moved into an old mill house in rural France.
I've had cocktail hours that last for 3 hours in Gascony before the meal even begins.
It's on the next Travel with Rick Steves.
You can hear Rick Steves at Saturday morning at 6 a.m.
Support comes from UT Health Houston, Houston's health university, where education, research, and patient care come together to help advance health and improve lives in Houston and beyond. More at houstonshealthuniversity.com. Support for Houston Public Media comes from listeners like you and from St. Arnold Brewing Company, a place for corporate events on tap, meeting rooms, AV equipment, and full catering available. More at starnold.com.
And now back to Hello Houston. To comment on any of today's topics, call or text 713-440-8870 or email us at talk@hellohouston.org. And now, Michael Adkison and Doug Miller.
And now it is time to dive into our current obsessions. This is a rundown of the things that are taking all of our free time. Current obsession is that TV show you run home to continue, that song you keep playing on repeat, that audiobook, or just the actual book. You get the idea, essentially. And as a warning, this is Doug and I's first current obsession. So of all we've been doing hard-hitting news. We are seasoned journalists, and this is the thing that caught us up. We were like, how do we do this? What do we do?
And I have to tell you, when I heard we had to talk about our current obsessions, like, well, I don't have any obsessions. Come on, what are you talking about? And then what have I been watching? And I realized the television show that I've been following, that I've been enjoying a lot, is a series on the National Geographic Channel. World War II history with Tom Hanks. Watched every episode of it, really was fascinated by it. And then I realized I do have an obsession, and it is World War II. I've been reading books on World War II for the past couple of years. When I retired a couple of years ago, believe it or not, when I was a kid, I used to watch the movie The Great Escape. And I always said, I'd like to go to that place where they did that. I finally said, I got the time. I flew over to Germany and went to Poland, and I found the place where that camp was, and I walked around there and got a tour of it, and it was just so I realized that's my obsession.
Wow,
it's a guy thing.
Yeah, I know. In my mind, I'm thinking Roman Empire. I'm thinking,
no. I tried to read a series of books on the Revolutionary War. Rick Atkinson's.
Oh,
series
sure,
on
yeah.
It bored me to tears. Just bored me to tears, but hand me a book on World War II, I can eat it.
I've always wanted to. I feel like World War II is one of those things that I never quite learned as much as I want to, but there's not like a good single volume. Here's the book on World War II. There's just here's the military. Here's the history of the Holocaust, the German World War, how the U.S. played. There's so many different like niche topics, but I'm like, I just want one big one.
That was also true. Watergate was the same way.
Sure.
There was not a single. Finally, a couple of years ago, a guy named Garrett Graff wrote a book.
Yeah.
Great book, Watergate,
really
a New History. Laid it all out in simple. Now, why did nobody think of that before? Somebody needs to do a one-volume simple history of World War II.
I love it.
In the meantime, watch the Tom Hanks show on Nat Geo.
We'll work on that. We'll write that book, you and I. But we've been getting some folks coming in with their current obsessions. From an email we got from Frederick, my current obsession is the art at the Geit Gallery. I've been purchasing art from the gallery since 2016. They have beautiful paintings and artifacts directly from Africa. I have not heard of the Geit Gallery, so I am curious and intrigued. You have caught my attention, especially if it's art that you can afford.
I'm thinking that must be, would that be, I'm trying to look something up here. Would that be Lloyd Geit, who is a former television reporter?
G-I-T-E is how
you
spell that.
I wonder if that's his place. Yep, it's Lloyd Geit's place. Congratulations, Lloyd.
There you go.
We gave you a plug. Who knows? Maybe Lloyd wrote that in.
Could be.
Yeah.
A text from a follower says, Reddit is my new obsession. Why don't people know how to wash themselves? I don't know that I want to know the context on that one, what you saw on Reddit. Another listener says, I've just discovered the old 90s Drew Carey show on one of those offshoot channels. I thought that he was just a game show host. Funny stuff. He thought that he was just the Price is Right Bob
Barker.
I was going to say Bob Newhart, and I'm like, that's not his name. Bob Barker replacement. I love it. That's a text from William. Reason 8 writes, my current obsession is nailing an MRI facility that can keep an appointment. That is, I can imagine that would be frustrating. And of course, my British computer guy, everybody knows we say his name frequently on here. No obsessions this week. Taking a break. Need to hear yours though. I love it. I love the idea of Ernie's on vacation and my British computer guy's on vacation too. No obsessions for this week. My obsession, I thought I'm similar to Doug in that I thought, what am I obsessed with? That's such a strong word. So I'll just highlight the book that I'm reading right now that I am enjoying very much. It's called Flower Traveled in My Blood. It is by an author. I'm trying to find her name here. Haley Cohen Gilliland is her name. It was a Pulitzer finalist and raved by the New York Times, and it intrigued me. After the show yesterday, we were talking about, or during the show, we were talking about family history and culture and everything like that. So my mom's side of the family is from Argentina, and there's a famous story where a friend of mine in college was studying Argentine history. We may have even talked about this after the show. I forget. She was studying Latin American politics, and when she found out my family's from Argentina, she was like, "You've got to ask them about the dictatorship." And I was like, "The dictatorship? What is she talking about?" My grandparents have never brought this up. And at Thanksgiving that year, when I saw my grandparents, I said, "Oh, my friend wants me to ask you guys about the dictatorship." I told her, "You guys probably don't know anything," and they were like, "No, we know people who disappeared. We know people who vanished in the night because they were taken by the junta." And I was like, "What in the world? Like, I've never heard of this." And so ever since then, I've been intentional about looking into the history of Argentina, and with them playing in the World Cup, everybody knows I was cheering for them, and was like, I want to read this book. It's been on my shelf for a while. It's essentially about the Abuelas de Plaza de Mayo, which were the activists who pushed back against the campaign. There were literally grandmothers and mothers who said, our children are gone, our children have disappeared, and we want to fight them. And it's just so powerful hearing these stories about women and old abuelas. Like, picture your grandmother just like activism and pushing back against a military government that was a dictatorship. It's so powerful, so powerful.
This book is getting great reviews. I've read some of the reviews of it. It's it's
really good. Highly recommend. It's very readable. If you're hearing me talk about it and saying it's a heavy book, it is the text of it, the context of it is heavy, but it is a very readable book. It's told through characters and real people who lived through this. It's very fascinating, very powerful.
This is why we need bookstores, and we can't just rely on Kindle and buying things off of Amazon. I've gone to the Brazos bookstore a number of times and seen that book and picked it up and looked at it and said, one of these days I've got to read it. I'm glad you are.
I'm plugging it. Great book.
Right.
Love the Brazos bookstore too. They do great stuff over there.
Yeah.
Love it. Keep letting us know your current obsessions. That's this segment, but we do like to hear what you guys think. So please continue to send those in, and we love to plug you guys and hear about what you guys are thinking. But coming up in the next hour of Hello Houston, we're going to continue, and you're going to hear from Ernie Manouse. He comes from within for one segment where he is going to talk to Morgan Freeman. He kept saying, I'm going to talk to Morgan Freeman, and I thought he was joking. No, it's Morgan Freeman.
Morgan Freeman.
That Morgan Freeman. So you're going to hear Ernie Manouse and Morgan Freeman coming up in the next hour as Hello Houston continues. Stay with us.
Stay tuned. There's more Hello Houston on the way. For the latest in local news, subscribe to the Hello Houston daily newsletter at houstonpublicmedia.org. Hello Houston is a production of Houston Public Media. The opinions expressed by the guests of this program are solely their own and do not represent the views of management, staff, or underwriters of Houston Public Media. This is News 88.7.
Support for Houston Public Media comes from Carr, Riggs & Ingram, a top 25 nationally ranked accounting and advisory firm, offering tax, audit, and business consulting services. Learn more at criadv.com.
Remember, you can watch Houston Matters and also Hello Houston on HPM Plus, free to download for smart TVs. 92 degrees, this is your NPR station, KUHF, Houston. News 88.7, a service of the University of Houston. It's 12 o'clock.
Just ahead on this hour of Hello Houston, Harris County Judge Lina Hidalgo asks once again for Commissioner's Court to consider a property tax increase to support a daycare and preschool subsidy for some residents. We'll discuss this and more as we continue diving into the top headlines of the day. I'm Michael Adkison.
And I'm guest host Doug Miller. Ernie Manouse talks with Academy Award-winner Morgan Freeman about his upcoming live concert experience in downtown Houston.
Plus, actress Elizabeth Bunch is joining us to discuss her role in Alley Theater's production of the psychological thriller, The Girl on the Train.
And of course, we want to hear from you. Give us a call or a text at 713-440-8870 or email us at talk@hellohouston.org. You can also watch us live on YouTube by going to houstonpublicmedia.org.
Hello Houston is made possible in part by founding sponsors John Bradshaw and Kathy Sanders and by gifts from listeners like you.
Live from NPR News in Washington, I'm Lakshmi Singh. Dr. Anthony Fauci, one of the most prominent figures in the U.S. response to the coronavirus pandemic, is being held in contempt of Congress for refusing to answer questions at a hearing last week over COVID's origins. Fauci invoked the Fifth in light of threats that he might still be legally exposed to GOP-led prosecution despite the preemptive pardon he was granted under the Biden administration. NPR's Eric McDaniel reports on a response from Fauci's attorney.
I actually just got a statement from his attorney, a guy named David Schertler. He said, quote, today's partisan committee vote is a crude political stunt intended to punish Dr. Fauci for exercising his constitutional rights, end quote. Schertler also said Paul has proclaimed that Fauci should be prosecuted and put in prison for years. And the attorney said, quote, Dr. Fauci has committed no crime.
NPR's Eric McDaniel reporting. Patients with alcohol and drug-related illnesses are struggling to get medical care in the United States. New reporting by NPR finds bias among healthcare workers is a major hurdle. Here's NPR's Brian Mann.
Addiction is one of the most common treatable illnesses in the U.S., but federal data shows more than 80% of people with substance use disorders never get treatment. NPR interviewed more than a dozen medical experts and reviewed research and found that many doctors and nurses are uncomfortable treating these patients. Dr. Judy Chertok studies addiction care at the University of Pennsylvania.
It's so jarring that is accepted by so many.
Federal data shows roughly 250,000 U.S. deaths every year are linked to alcohol and street drugs. Prescription medications proven to help reduce substance use are available. Research shows the vast majority of U.S. clinicians never offer patients those treatments. Brian Mann, NPR News.
The Federal Communications Commission has voted to lift a more than 20-year-old cap on the share of U.S. television households that a single company can reach. Current rule blocks a company from owning broadcasting stations that combined reach more than 39% of U.S. households. President Trump has again threatened to launch big strikes on Iran if there's no agreement. But as NPR's Frank Langfitt reports, some Israelis and Palestinians say they're tired of being whipsawed by Trump's accounts.
Leoman Iyer fears a sudden U.S. attack on Iran will trigger Iranian missile strikes here in Israel.
We don't know how lives will be changed based on a single tweet.
How does that make you feel?
Like a small, insignificant grain of sand.
Meanwhile, in the West Bank, Hussam Shamlawi, a cabbie, says Trump's repeated claims of opening the Strait of Hormuz has hurt his credibility in the region. He says when Iranians say they're in control, the media eyewitnesses, they all know this is true. President Trump said Tuesday a deal with Iran could come this week, but Iran says it's negotiating with Oman and denies talking to the U.S. Frank Langfitt, NPR News, in Tel Aviv and the West Bank.
This is NPR News.
Live from News 88.7 in Houston, I'm Tom Perumian. Emergency crews on Galveston Island battled a fire for several hours last night at a seafood warehouse. Officials say 3 people and a dog were rescued with no injuries. News 88.7's Juliana Washburn joins us live from Galveston to tell us what things look like this afternoon. Juliana?
Well, Tom, the fire has been under control since about 3 o'clock this morning, but I'm watching as crews continue to put out flare-ups right now. As I speak, crews are spraying water into the building that was once a seafood warehouse called Texas Gulf Seafood. Reports of a fire came in just before 9 last night, and I was here shortly after that. The entire building was engulfed in flames, and you could just see billows of smoke blowing out for miles. Officials told me early this morning that it was going to be a lengthy process putting the fire out. And actually just spoke with a woman who works at the warehouse. She cried as she watched it burn through the night. She was still crying this morning. She says working there is her livelihood, and she had to watch it go up in flames and disappear within minutes. A cause of the fire was not immediately reported. They're still investigating that, and we're keeping track of any updates. Live from Galveston, I'm Juliana Washburn, News 88.7.
An inmate who escaped custody while being escorted on a hospital visit in Liberty County is back in custody. 31-year-old Yorlan Rafael Reyes was picked up yesterday near Seattle, Washington, where he was doing construction work. He's been on the loose since July 18th. Reyes was in custody for unlawful disclosure or promotion of intimate visual material. Harris County commissioners planning to discuss funding the district attorney's investigation of the ICE shooting death of Lorenzo Salgado Araujo. That discussion will take place at Commissioners Court today. In sports, the Astros make their way to San Diego to open up a weekend series with the Padres. First pitch is at 8:40 Friday night. A bigger chance of rain today compared to earlier this week, now a 40% chance of rain.
Support for NPR comes from NPR stations. Other contributors include Fisher Investments. Fisher's dedicated team of specialists provide resources on investing, retirement income, estate planning, and more. Learn more at FisherInvestments.com. Investing in securities involves the risk of loss.
From Houston Public Media and News 88.7, it's Hello Houston, an open forum on today's biggest stories affecting Houston and beyond. Call now, 713-440-8870, or let us know your thoughts on today's topics by emailing us at talk@hellohouston.org. And now, Hello Houston.
Hello Houston. Welcome to the second hour on this Thursday. We just did current obsessions, and we were talking the little break that we had, and Jim, our producer, said it was a little bit of an academic current obsessions, a little bit different than what we're used to.
Highbrow
Obsessions. We like to come off as elitist. No, I'm kidding. Doug Miller sitting in with me today. We're excited about the second hour. Particularly, we got that Morgan Freeman conversation. But at the end of the hour, you've probably seen advertisements for The Girl on the Train at the Alley Theater. We are going to talk with the lead performer in that.
We are going to talk with the girl on
with
the train. With the girl on the train, Elizabeth Bunch, who, if you've ever gone to the Alley, you've probably seen Elizabeth Bunch on stage. She's a fine actress and one of the very talented people who's in this production, who's been there for decades. I think it's been more than 20 years.
Yeah.
I've seen her in so many parts. She's a great actress. I thought this woman was going to be stolen away by television. I told somebody at the Alley, Law and Order is going to pick her up. She'll be here for 2 years, and she's gone. She's still here, and it's a great thing.
I love an artist that stays in Houston.
You bet.
Ernie and I last week went to go see a show last week, and it was really just so exciting to see the art community here in Houston, just so vibrant. It's underrated that you have people who are so dedicated to the Houston area. I think it's fascinating.
Say if you go to 2 or 3 different theaters, go to Stages, for example, and then go to, say, Ensemble, you'll see the same performers popping up in different places in many cases, and it's a good thing to see.
I love it. So stick around, because we are going to talk and have that preview on The Girl on the Train.
The Girl on the Train.
Not Strangers on a Train. That's something very different. I love it. But we are going to get into the day's top headlines. Doug, take it away.
Harris County Judge Lina Hidalgo today once again tried but failed to convince commissioners to vote for a property tax hike to pay for a child care program. The property tax hike would have supported early childhood programming and help workers pay for child care. It would have required a referendum in November, but if all of this sounds familiar, Hidalgo proposed a similar program last year and brought dozens of children to a commissioners' court meeting trying to pressure her colleagues. It didn't work. If it had been passed by commissioners, voters would have had to approve the proposed tax hike in a referendum in November. So another plan from Lina Hidalgo goes down at Commissioners Court.
Right.
If you have any thoughts on that, give us a call at 713-440-8870. I'm a little surprised that this got brought up again.
That we're doing it all over again.
It popped up on the Commissioners Court agenda with little notice, and a beat reporter for the Chronicle noticed it, and what the heck is that all about? So,
something I think is interesting is and maybe this is more of a testament to local politics and how different it is than politics at the state or federal level. But at those levels, there's this idea of you're not putting something on the docket if you don't know it's going to pass. You don't, because you don't want to go through, I hate to say the embarrassment, but the embarrassment of it not passing. And so, here we are. It didn't pass the first time. The Commissioners Court has not changed, to my recollection, that and putting it forward to the second time, I don't know that the circumstances have changed at all, and clearly they haven't for the Commissioners Court. They voted it down again. So
not really. We'll see what happens next year when we have a new county judge.
Right.
Obviously, it'll be Letitia Plummer or Orlando Sanchez.
Right.
Which would be quite an upset in the city of Houston and Harris County if a Republican were once again elected county judge.
Right. I know Democrats are hoping that the odds are in their favor, that we can have a 2018 repeat and go down ballot. So, of course, that was the election that brought Lina Hidalgo into office. So we'll see if they can repeat in 2026.
Right.
So I will make another note to say that Harris County commissioners also did, I believe, approve an item allocating funds for the independent investigation into the ICE shooting of Lorenzo Salgado Araujo that happened last month. It's hard to believe it was 1 month ago yesterday that shooting happened. Of course, there's been a big push for an independent investigation from the Harris County District Attorney Sean Tier. The Harris County Commissioners were pushing to get funding for that, and we know that our Sarah Gruno is covering this, and that she's also going to be covering a press conference that County Judge Lina Hidalgo and District Attorney Sean Tier are going to be having in just about an hour. So you can keep around listening for that on our News 88.7 airwaves, and I'm sure there will be something on HoustonPublicMedia.org as well. On to the next story. President Donald Trump said on Monday that ExxonMobil and Chevron have made too much money on rising crude oil prices due to the Iran war. He told reporters at the White House they're making too much money based on a shortage. I don't like it. Exxon and Chevron on Friday reported windfall profits for the second quarter, according to CNBC. Chevron's earnings soared nearly 400% to $12 billion, compared with a $2.5 billion in the same period last year. Exxon's profits more than doubled to $14.5 billion compared to $7.1 billion from the same period a year ago. CNBC reached out to Exxon and Chevron for comment but did not hear back. What are your thoughts on the president's statements and these oil companies making a lot of money off of this war that's happening? Give us a call, 713-440-8870. What did you expect? What?
Well, yeah. Guess what? Gas prices go up, oil prices go up, oil companies make more money. This is a free market. I thought that the president believed in that. So, anyway, he said they're going. One of the other quotes from him said that they're going to have to give some of that back to the public, and they better cut their retail price. Which has been interesting. He's trying to be kind of a populist, of course, and he wants gas prices to come down. Obviously, this is something that is very much on voters' minds as they go to the polls in November. But this is people make money. Munitions companies make money during war.
Right.
If there's a war and it affects oil prices, oil companies make money. It's
exactly
that's the way the world works. But hey. So.
And I mean, of course, this is not some profound thought, but I think everyone's been comparing the circumstances of this Iran war to the circumstances that led up to the Ukraine war and its aftermath that, then raised prices of just about everything in 2022, including gas. I remember I was working in Missouri at the time, and gas prices, I remember hitting $6 a gallon, and I was making $31,000 a year, and that hit me kind of hard. Right. And it was the idea that, but that was the federal government's fault. But now you have the federal government, gas prices are going up, and the president just saying, no, it's the oil company's fault. It's not my fault. It's the oil companies. They're making too much money, and they should give it back to the people. So, just one of this is not new. It's not profound. It's the same old politics as usual of just, when I do it, it's okay. When you do it, it's wrong. And you see that from both sides on just about any issue.
Yeah. It strikes me that it's interesting that right here in the state of Texas, we pay 38.4 cents per gallon on price of gasoline. I'm surprised there hasn't been a more robust movement politically to try to, and perhaps even temporarily, lower that. We're talking about there's a state motor fuel tax of 20 cents per gallon, a federal excise tax of 18.4 cents a gallon. I'm a little surprised there hasn't been more talk about lowering those taxes. But let me make it very clear, though, that would make it very difficult for us to patch up our roads and build more roads. That it's a real conundrum. Nobody wants to pay high taxes, but we need roads.
It's all got to come from somewhere.
That's how we ended up with a lot of toll roads. That was kind of the solution for a while, but then there was a prairie fire backlash in the state of Texas against the expansion of toll roads. And well, how are you gonna pay for roads? That's the big question.
C'est la vie. I have to tell you, looking back on the Ukraine war, and I mentioned it was my first job out of college, and I was in TV and market 135, and like I said, I made $30,000 a year. Yeah. So not a lot of money. That really hit me hard, and I remember back then thinking, what I would give to have an electric car right now that I don't have to pay for all this gas. And how many years has it been? 4 years later, I drive a hybrid now. So I have not, it has not hit me hard with the gas prices increase. But those times when I have run out of the electricity and I do have to go to the pump, it's like, oh my gosh, it's I'm paying a third more than I would normally. It's just absolutely ludicrous. But
I'd be interested in hearing from many of our listeners who are thinking about or have decided to buy electric vehicles or hybrid vehicles because of the increased price of gasoline. If anybody's thought about that, give us a call, 713-440-8870. A good friend of mine just recently, earlier this week, bought a new vehicle. Didn't even think about buying an electric car. There's the range fear, the fear that you're going to run out of gas when you're in Mejia or whatever.
Sure, yeah. So. There's that fear, and it's not as worth it. And I have not looked into all the stats recently, so this is just going off of what I recollect, but it is not as worth it now to get an electric vehicle as it would have been during the Biden administration. There were all those tax subsidies and what have you under the Biden administration that now don't exist, to where it's no longer worth it to manufacture an electrical vehicle, and it's also not worth it to buy an electric vehicle compared to what it was before. So I just don't think you see as much consideration of it.
One of the great terrible things, I say great terrible things, one of the terrible things about our political dysfunction in this country is the fact that electric vehicles somehow became a political statement.
Yeah.
I mean, we need all the electricity we can get. Hey, this is Houston. We generally support the oil industry and so on. But by God, we need we need all the electricity we can get.
Sure.
And it just struck me that how in the world did electric vehicles become a political statement?
Especially when, just to remember recent history, that the idea of ending those subsidies for electric vehicles is what led to that falling out between President Trump and Elon Musk, because Elon Musk obviously is the founder of Tesla, which is the biggest EV company, I believe, in the world. And that idea, to your point about politicizing an electric vehicle, you've got Elon Musk, who is one of the most outspoken Trump supporters in the world.
Yeah. Writing a lot of checks.
And he is the head of the biggest electric vehicle company in the world. So you can't really square that circle. But
yeah. Well, anyway.
C'est la vie. 713-440-8870 is the phone number to call. We've got a call from Mark in East End on these oil companies. Mark, welcome to Hello Houston.
Hey, Mark.
Hey, how are you guys doing?
Good. How about yourself?
I'm pretty good, thanks. 2 comments. First, why are we surprised that these oil companies are making record profits while the rest of us pay the higher prices, when these are the same companies who have been lying to us for decades about climate change and are continuing to do so? Secondly, what Trump forgot to mention in his statement is that he owns millions of dollars worth of stock in both Chevron and Exxon.
Interesting. Yeah, I had not even looked at his stock portfolio. He's got a substantial stake in ExxonMobil.
He does. Yeah.
Ah, that's interesting.
Wow, Mark,
Good
thanks for calling so much. 713-440-8870. Victoria is on the line from Tomball. Victoria, welcome to Hello Houston.
Hi, thank you for having me. I heard y'all's segment and y'all wanted to hear. I recently switched to a hybrid Toyota Camry from a Volkswagen diesel Jetta, and that savings alone I'm grateful for with the cost of gas and diesel today.
So were you reluctant about buying an electric vehicle? Some people are afraid, like I said, that they're going to be out somewhere in the middle of, they're going to be in Marfa and their car will break down and they or whatever, they'll run out of juice and they won't be able to charge it. Did you have that concern?
I did have that concern, as well as just, troubleshooting, wear and tear. I wondered if there wasn't, a lot of electronic vehicle mechanics that I could take, like third party, or if I'd have to rely on going to a dealership for maintenance and a fix.
Yeah.
Victoria, thank you so much for calling into Hello Houston. We appreciate it.
Glad it worked out.
Coming up on Hello Houston, you missed Ernie Manouse all week. You're going to get him. He had a conversation with Academy Award-winning actor Morgan Freeman. You're going to hear that coming up on Hello Houston on News 88.7.
We know you value Houston Public Media. That's why you're watching right now. So take the next step and become a new member of the station you rely on. Every gift makes a difference. And what matters most right now is supporting the station that brings you the news and information you rely on. It only takes a minute to make a big difference. So join as a new member today at houstonpublicmedia.org/donate or call 800-364-8300.
This also means that when you're in the grocery store looking at pre-washed bags of lettuce, they're probably at an even greater risk than the whole heads of lettuce. You're seeing triple washed, you might think that's safer, but in reality, that bag of pre-washed lettuce might have been exposed to the contaminated poop water 3 times over.
I'm Michael Barbaro. That's Today on the Daily from the New York Times.
Listen tonight at 7 o'clock.
I'm Deborah Becker. Across the country, police departments are increasingly using AI-powered flock cameras to fight crime. The cameras track and record license plates and put them into a database. It means police can place suspects at crime scenes, but some officers are misusing the technology. That's next time on Here and Now.
Listen to Here and Now coming up at 1 o'clock today on News 88.7.
The Houston Public Media Foundation Board proudly stands with our community in supporting the Resiliency Fund. Their leadership and generosity are helping strengthen the future of trusted local journalism. Thank you to our Foundation Board for investing in Houston Public Media. Support for Houston Public Media comes from the Audi International School, where students from PK3 to 12th grade grow in curiosity and courage, preparing them to make their mark on the world. The future's so bright at Audi. More at audi.org.
And now back to Hello Houston. To comment on any of today's topics, call or text 713-440-8870 or email us at talk@hellohouston.org. And now, Michael Adkison and Doug Miller.
Not that Morgan Freeman needs any introduction, but you know him from all of his iconic roles. The Shawshank Redemption, Seven, I forgot he was in Seven, Driving Miss Daisy, and $1 Million Baby, just to name a few. You know him from his voice, which he has lent to documentaries like the Academy Award-winning March of the Penguins, but now he is lending that voice to a touring live concert that is going to make its stop in Houston tomorrow evening, called Morgan Freeman's Symphonic Blues Experience. And Ernie Manouse, who also needs no introduction, spoke with Freeman and his business partner Eric Meyer about this live concert experience. Take a listen.
I would guess that to enjoy the blues experience, and we're going to talk about the symphonic blues experience that you're bringing here to Houston, but you don't have to be steeped in blues music. It is a music that permeates all aspects of our lives, and many people listen to it not even knowing or categorizing it as the blues in a lot of opportunities. You can just come to enjoy music.
100%. I mean, I think as Morgan said, it's foundational. It's integrated into so many forms of music, whether it's jazz, hip hop, rock, even country. So I think if you enjoy good music, which I obviously do, Morgan, and others do, what a great way to spend a night. So I was kind of a late bloomer for this genre. I was involved with the grunge club in Seattle that was kind of the epicenter of that movement. And so took a trip with my girlfriend down to Clarksdale, stumbled upon this and said, this is really entertaining. And that, afforded me the opportunity to lean in and partner with Morgan and Howard Stovall and Bill Luckett to be part of this adventure.
So which one of you wants to share? Because we kind of lost the lead in all of this. What is Morgan Freeman's Symphonic Blues Experience?
And it's all because of Eric, is taking a small group of blues musicians and mix them with probably the only genre of music that American blues has not invaded. And that's, European style classical music.
Mm-hmm.
So now the blues experience itself is being merged with another genre that it hadn't had a shot at before.
Eric, so what do people experience when they're in the theater for this?
Well, I mean, we're walking this tightrope of edutainment. And what I mean by that is it's great entertainment that also tells a story. And the way we do this is threefold. You've got classic blues songs that span a 100-year arc. And this is performed really by a combination of Mississippi bluesmen or blues artists in combination with local symphonies, like what we're going to be doing in Houston. Secondarily, you've got video storytelling that accompanies this. So you get a cinematic experience of really what each song is communicating and the narrative of that. And then you've got the world's greatest storyteller here, Morgan, providing a story arc that really helps connect this genre over this 100-year period. So Morgan tells a story. We filmed him at our club, Ground Zero Blues Club in Clarksdale, and that's then shown on the big screen. So it's a really, really neat experience. It's unique on a couple forms. One of them by the combination of these two genres, but also the delivery approach that we're doing here as well.
Yeah. Mr. Freeman, I guess part that keeps coming up again is categorizing things. And I think all too often we fall on that as a crutch instead of just accepting music as music, art is art, performance is performance. Is there a disservice we do when we categorize things out, when we separate art forms instead of merging them?
I don't know how to comment on that, because I think we have to categorize in order to know what the heck we're talking about in any one subject. So I can't agree that we're doing a disservice by categorizing. I think we're doing a great service. Mm-hmm. Here we got another source of categorization. And what are we going to call what we do?
Well, it's going to be the symphonic blues experience. It's going to be very unique unto itself. What fascinates me, though, is your involvement with it because, as Eric mentioned, you're seen as this great storyteller. You have this voice that carries weight with it and importance when you speak. When did you first realize you had that instrument in you?
I guess not until somebody told me that this was so. I realized it. I don't think I ever actually realized it. It's just, what do you do when somebody said, "Oh, that is such a special gift that you have"? Really? Okay, fine. As far as I can take that.
When I made the shift into radio from television, people would often say, "Oh, you've got a great radio voice." And I thought my entire life, the one thing I didn't like about myself was my voice, the way it sounded. And then all of a sudden people say, "No, that's great on the radio."
One never knows.
Yeah, never know what people are going to hang their hat on when it comes to that.
Right.
When you are telling a story, when you are reading a script, a narration, how much does the acting ability come into creating the story as opposed to just finding the inflection in the words? Is there a separation in that? Do you approach a narration differently than creating a role? Or for you, is it often very similar?
No, I think it's very similar. I don't think you either have the ability to express what you're reading or not, So when someone writes something for you to say, there are 2 or 3 things that happen. One of them is you sort of think about your elocution, and the other one is pitch. Mm-hmm. So some of the people have told me, "Oh, you have this voice. Now, where do I place it if I'm going to do a narration?" To me, it sounds different for different things to do.
Is there a certain sincerity you think you bring to this, or are you kind of surprised at the attention you get when you narrate?
Yes.
Yes. Eric, let me ask you then on the tails of that answer, how different you think this experience would be if you didn't have Morgan Freeman?
I'm going to plead the fifth here.
Let me answer that one for you, but because no, it's this doesn't even exist without Eric.
Yeah.
So pleading the fifth is just refusing to stroke his own ego.
Well, actually, you know what? I would actually contend that the show is about our musicians.
Yeah.
I mean, we are producers alongside of Howard Stovall, who's also a partner of ours. But the real magicians here are these incredible artists from Mississippi and the local symphonies, and that's what it's all about. And we're here to kind of tee it up, and it's been a blast of a project to work with Morgan and Howard on this, and the response has been phenomenal. We're so happy to be coming to Houston.
Yeah.
But at the end of the day, we're really in the background. I did want to let you know that we're very blessed that we have signed a record label deal. So assuming everyone has a great time, we're going to be releasing a record August 14th. We signed it with Universal Decca, and we've had a couple singles already go out. Death Letter Blues, and Taj Mahal is the vocalist on that, and then also Cadillac Assembly Line with Keb Mo. So, my sense is if you have a great time and you want to keep that magic to be able to listen to at home or at work or in your car, Morgan Freeman's Symphonic Blues Experience will be released both digitally and on physical medium as an LP and CD starting August 14th.
Well, that's wonderful. Do you see this as a new shift in music genre, or do you see this as kind of a one-off oddity?
This is a completely different approach, I think, to music presentation. It's only partially unique because Ray Charles did this way back.
Yeah.
And he did it with country music, not necessarily the blues.
Uh-huh.
You know, called the blues.
Look, the concept of crossover music has been around, bringing music to new audiences. I saw a hip hop band do this down in Australia, and that was kind of the inspiration for this concept, to see if they can do it, we can do it, and then add the storytelling component. But you're seeing that John Batiste has done a great job in doing that, of kind of bringing audiences together. So I do think one of the beauties of this music, it is timeless. I think the way we've done the show and the album, you'll see it kind of contemporary, makes this much more really enjoyable from a contemporary listening vantage point. The symphonies bring gravitas without really diluting the blues music and turning into what I call muzak. So I think we'll see more of that. I think it's only, and this is just a need for it. And to your question, is this a one-off? I don't really look at it. I mean, I don't think I'm smart enough to answer that question. Morgan maybe, but I'm not. But it's just we set out to create a great experience for consumers, and I think we've done that. So I think the rest of it will be up to probably someone else. And if it goes viral or catches on, then we've done a great job. If not, if you had a great time, mission accomplished.
Yeah. And I guess the point of my question and why I even asked it was the fact that when you think of a live experience happening in the theater, oftentimes those are unique once in a lifetime experiences, or a particular program that does that. The idea of recording and then releasing an album of it is kind of laying a stake in this genre of music, is saying, hey, look, here's a commodity here that there could be more of this, more artists doing it, more exploring this combination of the blues with symphonic sound.
Yeah, I mean, I will tell you, you take blues legends like Bobby Rush or Kev or Taj or Shamika Copeland and others, they all want to be a part of this. So we're obviously onto something that they're approaching us. And the fact that symphonies want to join and be a part of this tells me this should have a great lifespan. But at the end of the day, it's up to listeners to make that judgment, not us.
Yeah. When you talk about a great lifespan, Morgan, you've had a great lifespan. It's a bad segue, but I want to get to a quote you made about retiring. And people always saying, well, what are you thinking about retiring? And I'm going to paraphrase, and you can correct me here, where you'll bring up, well, the idea appeals, and then all of a sudden the next offer comes and you're back in the game.
Good paraphrasing. That just about hit it on the head. I don't think in this business, there's very few of us who, quote unquote, retire.
Yeah.
We are retired. The phone stops ringing. You've passed your time limit there. And the other thing is that I believe in what Clint Eastwood has said about aging. Just don't let the old man in.
Yeah.
Forget it.
I mean, Morgan, what else should you be doing?
Well, yeah, exactly.
Do you find the change in the industry and the technology and all of that changes or impacts the way you approach the work you do in front of the camera anymore?
No. That isn't how we are affected with artificial intelligence, at least not yet.
Yeah.
I know that there are images of me that have been created, and some people hear my voice in different places doing things I never did. But overall, I wouldn't say that it changes our approach to just the work of acting.
Yeah. Do you still enjoy it on the same level you did?
Yes, so I was born to do it. So,
yeah.
So when do you decide I don't like doing this anymore. It's to me, it's ego stroking.
I'm also curious about live theater, and in some ways this kind of brings it all back together. If you can be there, I know a lot of what you do in this is recorded and up on a screen and stuff, but to be in the theater as opposed to being on a sound stage, as an actor, do you find a certain thrill with one over the other, or are they all basically the act of acting?
They're all basically the act of acting. Well put. My last stage presence, as it were, acting on stage in a play, was in 2008.
Mm-hmm.
After that experience, which here again, I say, I'm actually born to do this sort of work, but I always wanted to be in the movies. Now I'm in the movies, and the last play I did was, I sunk in it. Put a T in there also. Stage presence, I guess you have it if you do it. Me and Eric, we just go on stage to Chatterbug?
Catch up. Yeah, catch up. If Morgan, if I got it, I can tease him a little bit, and he teases me a little bit, and Howard joins us sometimes as well. It's just a way to catch up. Look, music is connection.
Yeah.
And I feel so lucky to be working with Morgan and Howard on this, and be able to bring this to folks who can't make it to Clarksdale. Definitely a shout out for folks. If you're feeling like a little road trip, come see us. It's about an hour and 15 south of Memphis, top blues club in the world. Great music, 200 nights a year. And for those that can't make it, this is why we're coming to you.
Yeah.
So I'm looking forward to some good queso and Vietnamese food, and bringing the show to Houston.
Well, we got that for you. Definitely that. And we also have the heat. We have a lot of heat here for you. So don't worry about that.
Well, we don't need to go to Houston to get the heat. Trust me.
No, we're part of that heat.
Yeah.
Quickly, Eric, before I run out of time, I'm just curious. Your first meeting with Morgan, how was that for you? Realizing who you're meeting.
Oh, you should have seen him. Jumping up and down. I mean, literally a grown man.
Yeah.
Up and down and grinning and stuff. I
had my autograph book out, and it's a big, it was I think it was like page 32, And he looked at me, he kind of wanted to cast me aside and get back to his Tito's and joke telling. But look, it's what you see is what you get. That's one of the incredible joys of Morgan and building a friendship and working together. It's neat to be with people that are incredibly authentic. And I think that's probably the best way to define this person, and incredibly smart. So just don't ever play world geography with Morgan. You will lose.
All right, I'm leaving my Trivial Pursuit game at home when I come to see you folks. For Houston Performing Arts presents Morgan Freeman's Symphonic Blues Experience at the Wortham Center on August 7th. Gentlemen, thank you so much for taking the time out to chat with me a little bit about this.
It's been a pleasure to talk to you.
Thank you.
All right. Take care.
That was Academy Award-winning actor Morgan Freeman and his business partner Eric Meyer, and of course they spoke with Ernie Manouse, whom you know well. Morgan Freeman's Symphonic Blues Experience will take place tomorrow evening, August 7th at the Wortham Center. For more information, visit performingartshouston.org. Coming up, another performer, Alley Theater's production of The Girl on the Train. We're going to talk with the lead actress. Stay with us as Hello Houston continues.
It's not just your car. It's the one that brought your kids home from school, took you cross-country, held memories, laughter, even a few breakdowns. When it's time to let go, give your car a new purpose. Donate it and turn memories into meaningful support for this station. Plus, you'll enjoy free and easy pickup, potential tax benefits, and a simple donation process. Your gift supports the programs you and your family love. Donate today and help keep public media strong. Call or donate online.
Your company participates at houstonpublicmedia.org/match.
Hey, it's Francis Lamb, host of The Splendid Table. This week, we're chasing smoke. We're talking about live fire grilling across the Middle East. We've got Tennessee pitmaster Pat Martin talking about saving his beloved style of whole hog, and cookout etiquette with the hosts of the podcast, Were You Raised by Wolves? It's coming up on The Splendid Table.
You can hear that Sunday at noon.
We yearn to get back to a time when we worked with our hands, but what era are we actually talking about?
Is there something really positive and radical here, or is Girl Nostalgia just something that's possibly reactionary?
The centuries-old longing to get back to the good old days of craftsmanship and how that can go awry. That's next time on Think.
Listen to Think. It's on tonight at 11.
Universities are struggling to keep up with technology, both teaching it and using it. And yes, we are talking about AI.
One of the things universities are really good at is posing questions not about what's happening today, but about what might happen a decade from now.
Here's a question: how much is it going to cost? I'm Kai Rizdal. That story next time on Marketplace.
Listen to Marketplace later today. It's on at 6:30.
And now back to Hello Houston. To comment on any of today's topics, call or text 713-440-8870 or email us at talk@hellohouston.org. And now, Michael Adkison and Doug Miller.
Summertime is summer chills time in downtown Houston. Every summer, the Alley Theater stages productions of murder mysteries and classic whodunits and suspenseful thrillers. And this month, it's The Girl on the Train, the psychological thriller based on the blockbuster bestseller of the same name. If you've read the book or seen the movie, you know that it's a twisty tale with a lot of surprises. Well, even if you've read the book or seen the movie, this production's worth seeing. The production is getting rave reviews from critics, and the star of the show is a familiar face for theatergoers in Houston, resident member of the Alley's acting company, Elizabeth Bunch. Elizabeth, welcome to Hello Houston.
Hi, thanks for having me.
It is so great to have you here. Now listen, without giving anything away, for anybody who's not read the book or seen the movie, tell us a little bit about what The Girl on the Train is about.
The Girl on the Train, I mean, the easiest way with a mystery, because you don't want to give away any of the twists.
Of course.
You sort of, the first scene, you wake up and you meet this woman, Rachel, who is that's the character I play. And she appears to maybe have had a rough night. There are bottles everywhere. And she wakes up to her doorbell being rung by a detective to let her know that she's being investigated as a witness or maybe a suspect in the disappearance of a woman. And you sort of, as you start putting the pieces together, you realize my character has a bit of a drinking problem. She has a lot of blackouts. She's not sure, but she thinks that she saw something or was there when this woman went missing. And so you start to meet this cast of characters, people, her ex-husband, his new wife, start figuring out. She sort of takes it upon herself to try and figure out this mystery, but she's an unreliable narrator because she doesn't really remember what she saw.
So during this production, you almost never leave the stage, and you play a character who, as you say, is an unreliable narrator. I wonder, as a performer, you know, this is a character who's racked with self-doubt. Do you have a problem at all? Was it hard for you to get to know a character who doesn't know herself?
You know, what's interesting is because I love doing these murder mysteries at the Alley Theater, and we tend to do one every year, if not more than one. I love being the detective, and as an actor, you're sort of a detective as well. So I would say what was difficult for me in this process is keeping in line the things at what point in her journey she could remember what and what information had been given to her. It's hard not to leap ahead and go, oh, but I know that he was there this night or she was there that night. You're, no, I don't know that yet. The audience doesn't know that yet. And then we have this extra layer that's kind of fun. I think we're really good at it at the Alley, is sort of making sure we don't let the audience get ahead of us either. So you also have this hat on, a director's hat, if you will, of sort of throwing in red herrings when you can, so that you can continue to make sure you're misdirecting the audience in a way that's truthful for your character. My character, because she can't remember anything, sometimes thinks that maybe she is responsible for this missing woman. So that's kind of a fun layer. So yes, there's many unreliable things going on in my mind while I'm creating it.
That's funny. I hadn't thought about playing a murder mystery and you know the ending, but you have to act like you don't. Like
Yes, absolutely. But at the same time, you want to be a truthful actor. So in one of these, if you are a guilty character, you have to know you're guilty from the beginning, but you have to be a good liar to your scene partner so that the audience also doesn't get ahead. I think it's really
complicated,
fun.
but it's fun.
Yeah. And I think that's why the audiences eat it up.
So this is a part of the Alley's Summer Chills series, which has been going on for about 20 years now. It's been a long time that these plays have been going on. Many of these have been more traditional kind of mysteries. A lot of Agatha Christie. There was a Sherlock Holmes, I believe, a few years ago. But this is a more modern thriller. It's based on a 21st century novel. It's a psychological thriller. It's fast-paced with a lot of digital projections. I get the sense that when I think about the past Summer Chills, they were a little more traditional, kind of drawing room mysteries. But now this is kind of we're getting into some newer, edgier material. Am I correct in that perception?
Yeah, I think it fits in really well with what our season has been this year too. And at the Alley, we're sort of trying to be everything to everyone that we can. And so we're always investigating what is interesting to the Houston audiences right now. And we have done a lot of Agatha Christie's. It's even longer than 20 years that we've been doing Summer Chills. It predates my time at the Alley.
Wow.
And it used to be that the Alley season was dark in the summer. This is the lore that I have heard around the building. But we have a resident acting company, and very few theaters have that. Right. And the goal was to keep the acting company employed through the summer, so the theater didn't go dark. And so they started by creating these Agatha Christie or small murder mysteries. They even were doing two. They would find one set, the drawing room, the parlor, the whatever, and get the acting company to come in, and they would do 2 weeks of one show and 2 weeks of another show, and they wanted something that we could rehearse really quickly. Well, Houston went crazy for it. Why not be in the AC in the middle of July and August? So it has evolved into something that has become much bigger and grander. And like Girl on the Train is a huge production in terms of, what the effects are and what the projections and all of this. The sound design is amazing. So yeah, it's really kind of stepping out of that kind of drawing room, motif and doing something bigger, which is fun for me.
If you watch the clips online that are available, or if you just go see the show, you might as well. It feels very Curious Incident to the Dog in the Nighttime. Just the projections and the sound and just the staging. It's very digital and very 21st century of modern. I don't know. There's something so minimalist and yet maximalist about it.
Yes. Well, you look at these Agatha Christie plays and they take place in one location, and off it's almost continuous time, or maybe over one night or 2 nights or something like that. This, takes place all these different locations, moving on a train. You've got all these different things. So I think it's really fun that we've found a way to make it cinematic. And that's kind of been a theme for this whole season of the Alley, which has been really fun for us.
Yeah. So this play, I believe the stage production, I believe it premiered in London and then it went to New York. Is the staging of it similar to London, New York, or was it reimagined for Houston stage?
This is totally for Houston for our production. We are in contact with the playwright, Rachel Wagstaff and Duncan Abel. They also did the Da Vinci Code that we did earlier this season, and it was great. We sort of had they're across the pond. So we had a Zoom session with them early on, and they were so excited. They're like, we have loved everything that the Alley has done with our work. So we don't even want to tell you what has worked or not worked in other productions. We totally trust you, and we want to see what you do. And this was a new design team to the Alley, but I feel like this team really came together and created something really special. We had understudy rehearsal yesterday, so that means I got to sit in the audience and watch for the first time, and I was like, oh my God, all of that is going on behind me? I had no idea. It is so cool.
Does it make you... did the playwright, for example, I mean, was there anything about the production that was shown to her? In other words, has she seen the clips? Has the playwright seen the clips and so on?
I would imagine so, but I haven't been in touch with her since the rehearsal process. I'm still hopeful she'll come. She came to see Da Vinci Code.
Wow.
So yeah.
Which I was about to ask you about. Does it make you nervous when the playwright is in the audience?
Yes.
Yeah.
I mean, you want to be word perfect all the time, but when you're doing a dialect, you're like,
Sure.
hi, I'm in Houston, Texas, and I'm doing a British dialect. And like, what do you think? But, it's such an international city anyways. There's plenty of people I should be nervous about out there every night anyways.
Do they tell you ahead of time, hey, no pressure, but the playwright's here?
People are different. I think when you have somebody visiting from that far away, we tend to always know that they're in the audience.
They're in the room.
Yeah. It's a different, we do a lot of new work at the Alley too, so the playwright will be in rehearsal with you almost every day.
Yeah.
And that's a special thing too. And then you really get to know that you are serving what they want because they'll tell you when you're not.
Question for you from our YouTube.
Yeah.
My British computer guy asks, is this a faithful adaptation of the book, or have any directors taken creative liberties? No spoilers. They make a note of saying.
No spoilers. It is... I think it is creative.
Okay.
Because I think the thing that's really interesting, I've read the book, I've watched the movie. We are celebrating what theater can do with that story. And I don't think it's a spoiler to say one of the things that's really successful about the book is it's from three women's point of view. That I think ultimately becomes too complicated to do in a stage adaptation. So it's from my point of view, so sorry. But they've really focused on Rachel's story and how she experienced it. I really love in the book being able to be in three different women's minds and putting the pieces together in that way. But so yeah, things like that are different. And it's condensed in terms of location and time.
Sure. As an actor, when there is such a body of adaptations, a movie, a book, does that help you prepare for the role? Or do you think it's more of a, whatever? They did, Emily Blunt did whatever, I'm going to do my own thing.
Yes, for the Emily Blunt. But I love research. I really love getting deep into stuff. We just did Misery. And I mean, it wasn't just about the movie and the book for me. I had never read Stephen King before.
Wow.
And I went nuts. I spent a year reading every Stephen King book I could get my hands. Well, you can get your hands on too many Stephen King books for a year. But I love delving into that. And I've made the mistake in the past, or made the choice in the past of saying, okay, I know there's a movie of this. I'm going to completely exclude it. When it's famous or a big deal, your audience hasn't excluded it. So I feel like I shouldn't come to the role less informed than my audience is, because I want to know what choices they think they've already seen somebody make, and I can choose to make the same or different. So mostly I try to, take in as much as I can about any show we're doing.
I feel like I haven't heard that take before. Like, I feel like most people are to the point we were joking earlier. Oh, Emily Blunt, whatever. I am my own actor. I'm going to do my own role. But I feel like you don't hear people say, no, the audience is coming with this context. Why shouldn't I?
Well, especially like Kathy Bates and
right.
Misery.
Oh
you can't say like, I'm not going to pay any and it's the
Who's
same.
Kathy
No,
Bates?
I know. Same adaptation, or the same adapter of the screenplay and the play. So it's like, look, if there's an iconic way of saying this line, and I go in and do a different thing. I mean, then you can go full tilt the other way. We did Clue as a Summer Chills several years ago, so it's not always Agatha Christie. We've taken some other risks too, but like, playing Mrs. White in Clue, flames on the side of my face, I'm going full Madeline Kahn. Nobody wants to see my take on that. No. There were people dressed as Madeline Kahn in the audience.
Oh, that's hilarious.
I mean, it was like...
Well, you mentioned Misery. You starred as Annie Wilkes in that. You co-starred with your husband, Chris Hutchinson.
Yeah.
Now, this is interesting. Both of you have been with the Alley for how many years now?
20 plus change.
Okay, all right. So I wonder, all these productions, you've been in more than 100 productions. I saw an article, you've more than 100 productions with both of you. Congratulations on that. But how has your collaborative dynamic evolved over the years? Do you discover you're acting differently next to your husband than you did decades ago?
Yeah, I mean, nothing makes an actor better than getting to do work all the time. And that's what the Alley has given us, is that we get to work all the time. So we have both grown and changed, but we've been doing it side by side. We met doing a play at the Guthrie in Minneapolis. So I knew Chris as an actor before I knew him as, a boyfriend. And I do, we work really well together. I don't think you can be with someone that you don't have the utmost respect for what they do in life. And I have the utmost respect for him as an actor and as a talent. And occasionally we get to do things. I mean, Misery was such a gift. It's such a weird thing to say, but for us to play those roles opposite each other was so meaningful to us. And, we spent a lot of time at home talking about it, not working on it. Not officially, yes. No, we did that in the safety of the building at the Alley. But no, it's really special. And there's so few people that have had, that kind of chance to work with their loved one.
So you really enjoyed torturing your husband.
I really did.
Yeah. Okay, just checking.
We have some good stuff in this one too. So, mm-hmm.
Well, I must say this seems like a dream job for you and for your husband. I mean, so many people, actors, in order to make a career, you have to go to Los Angeles, you have to go to New York. The two of you were able to come here. You've been able to raise a family, and this seems like a perfect, ideal situation. And I understand your kids are getting into acting as well.
Oh my gosh, I know.
Wow.
Look out.
You're a modern-day Barrymore family.
No, it's crazy. Both of our kids are going to be at HSPVA this year.
Wow.
Yeah, we'll have a senior and a freshman in the theater department at PVA. And it's really special. They've both been in Christmas Carol with us. They've both played at different times Tiny Tim while we're Mr. and Mrs. Cratchit. It's an unusual life that we're leading, but it really is very special. And yeah, Chris and I were in New York when we started working at the Alley, and we sort of used to bounce back and forth. And we made the choice to be here and to stay here because this is an incredible place to raise a family. And the opportunities that our kids have had being in this city, I love it. We're so happy here.
Yeah, we were just talking about, we only have a minute left, and yet I'm opening up a whole can of worms. We were just talking about how great of a city Houston is for the arts. It's an underrated city.
Yes.
Just the representation.
And in the 20 years that I've been here, the theater scene in Houston has grown and flourished in a way that is so exciting at a time where we're looking nationally at theaters folding.
Yep.
All the local theaters right now are announcing their seasons for next year. It's great. We're super excited. Chris and I, the first show that Chris did at the Alley was Proof. It was my third show. And now we're in the season of Proof revivals with Fourth Wall doing it next year. So
I love it. Elizabeth Bunch is an Alley Theater resident acting company member playing Rachel Watson in their Summer Chills production of The Girl on the Train. Elizabeth, thank you so much for joining Hello Houston.
So happy to have been here. Thank you.
I know. It made me excited for the show. Everyone needs to go see it.
Yay.
And that is going to bring us to the end of Hello Houston. Thank you so much to Doug Miller for filling in the guest role spot. Appreciate your time.
Pleasure being with you.
I love it. Tomorrow, we're going to learn about the Houston Forensic Science Center. All this forensic mystery. Stay with us.
Thanks for listening to Hello Houston. Join us every Monday through Friday from 11 a.m. to 1 p.m. to talk all things Houston. The Hello Houston production team includes Garrett Bowman, William Menivar, Laura Walker, Jen Altide, Todd Holslander, Jayla Rhodes, Mark DeClaudio, Tom Carter, and Jim Kovacic. For the latest in local news, subscribe to the Hello Houston daily newsletter at HoustonPublicMedia.org. Hello Houston is a production of Houston Public Media. The opinions expressed by the guests of this program are solely their own and do not represent the views of management, staff, or underwriters of Houston Public Media.
Support comes from the Museum of Fine Arts Houston, presenting Ernesto Neto Sun Force Ocean Life, an immersive exhibition